Thank you. Wow, we are hitting all the points this morning. I guess I got to tighten up my chart game. I will also just say what I'm hearing, just completely separate from the questions I'm going to ask, is some opportunities for bipartisan support. And when it comes to unaccompanied migrant children, Congress is actually the body that makes the laws and has the ability to give HHS the jurisdiction and the funding and resources to do exactly what I'm hearing so many of my colleagues say is critically important to them. So I welcome a partnership with anyone on the other side to do just that, to make sure that these kids are safe and not twisting in the wind, as we've heard this morning. So I'm here, 2458 Rayburn. But moving on to my questions, which seem even more relevant today. I want to talk to you a little bit about Black maternal mortality. We just heard this week that Olympic track and field champion Tori Bowie died from childbirth complications in this country. I was never more aware of the risks to Black women in their maternal health as I am now that I am in Congress. American moms are dying at the highest rate in the developed world, with Black moms experiencing pregnancy-related deaths 3 times higher than white women. Long-standing variations in access to quality health care, underlying chronic conditions, structural racism, and implicit bias contribute to these extreme disparities. According to the CDC, social determinants of health prevent many minority groups from having fair economic, physical, and emotional health opportunities. To close these long-standing disparities, I recently led the Social Determinants for Moms Act, included in the Black Maternal Health Momnibus Act, which was introduced by Representatives Underwood and Adams. The Social Determinants for Moms Act establishes a whole-of-government task force to develop comprehensive strategies to eliminate preventable maternal morbidity and maternal health disparities. President Biden's budget includes $937 million for the maternal and child health block grants, an increase of $122 million from fiscal year 2023 enacted rates. Approximately $145 million will support investments to address disparities in maternal mortality and morbidity, including proposals to address social determinants of maternal health. Secretary Becerra, how does the Department of Health and Human Services plan to invest the $145 million to ensure the most underserved communities are reached? And additionally, would a task force dedicated to eliminating preventable maternal mortality and maternal health disparities be a resource to HHS?
Congresswoman, thank you very much for the question and all the work that you've done on this. We hope that the president's budget can be fulfilled because that would let us reach many communities. We would use some of that money to not wait for folks to come to us, but to go to them where they live. And so, for example, we are planning to continue to expand our access to women who are planning pregnancy through the doula program, so we can make sure that women are receiving care, not just at the point of delivery, but before that, so they're preparing for that delivery and having good health outcomes. So we're going to continue to work with community health centers, with those programs that reach out to do community health service work, to try to make sure we're getting to people early, because someone who's an athlete at a young age of, I think, 32, should not be dying in her home alone because she's pregnant. But that's where we are. And so people are not being reached. We intend to use the resources to reach them.
Thank you. And rightfully, that should not be happening in the United States of America. My next question, 12.5 million children currently are potentially eligible for child care subsidies under federal rules, but only 16% received subsidies in fiscal year 2019. Last Congress, Democrats in the House passed the Build Back Better Act, which included programs for the expansion of high-quality child care. Unfortunately, this failed in the Senate. But we know that we definitely need to update our child care system. What would it mean to expand child care, not only access, but accessibility to American families so that they're able to afford care?
Well, as you just said, we'd be able to get to more than 1 in 7 children who need that child care. We'd be able to expand that dramatically. We'd also be able to increase the wages of those workers that we depend on to care for those kids, because right now, I believe the average wage of a child care worker is a little over $13 an hour. You can flip burgers and make more money. And so we hope that you are able to secure some of the funding. I believe we're calling for some $400 billion in new investments in child care services and Head Start in the President's budget. We hope you can get us there as far as you can.
Thank you. I yield back.